Good morning. My name is Belinda Manchester, and I'm doing this video to share with you the language of pain. Most of us really do not like to admit that we have pain. And, the whole concept of mind over matter, if you just don't focus on it, it will go away. And that's true in most cases. But sometimes it's the body's way of communicating to us about something that the mind needs to shift about. Now, if you're not ready to shift on a specific subject or a belief system, then it needs to be, addressing it on a physical level will be beneficial. It reminds me of a research done back in the 70s with those Olympic athletes who they had two groups. One did just a visualization of a workout. They sat in a room, closed their eyes and imagined themselves working out, doing the same workout as the second group that was actually physically doing the workouts. And both groups had improvements. The second group that only used visualization had a 50% improvement. And that tells me that sometimes it does need to be addressed at a physical level. So physical pain. Whenever there is pain, then it's the body communicating to you that there's something going wrong in that area, or there's something going on, you need to address it. Most of us don't realize what our body is trying to tell us. So neuromuscular therapy modalities are what I have found to be most effective when you have physical pain. Now, the neuromuscular therapy modality that I use is trigger point therapy, so I'll be using that throughout the session, and you can do research on some of the others. So the trigger point therapy that I learned was based from research done by Dr. Travell and Dr. Simmons back in the 50s. Their cancer patients would come in complaining about pain that was not related to their cancer. So both doctors started doing research independently and then discovered that they were both working along the same lines, and so they started collaborating on their work. Dr. Perry, which is the lady that I trained with, took the research and developed protocols, and that is what I use. So I'll get back to the protocol in a few minutes, but I want to first explain to you what your body is trying to communicate to and what to look for. Now, the first signs that you have trigger point activity is that you start feeling heat, numbness, or you can feel an ache, not pain, but it just feels heavy or feels tired. The area or the muscle will feel tired or heavy. And most of us, if we put a hot compress or if we take a warm bath, then it'll feel better. A little bit of hand massagers on your neck or shoulders can sometimes alleviate that sensation, and that does help. So then let's say you ignore it, you don't really do anything about it, you don't use a hot compress, and you continue with your stressful activities, whatever they may be, and then you start to get spasms. That's where the nerve ending and the muscle fibers are communicating so that they determine what relaxed state is for those fibers. The muscle fibers, when they become contracted enough near the nerve and start stimulating that nerve continually, then the nerve sends a signal to the brain saying there's a problem here. This muscle is constantly putting pressure on me and it's not going away. So the nerve will send a signal, the muscle will respond and relax for a second, and then it'll tighten back up because our muscles do have memory. And so the muscle will go back to what it feels its normal state is. So if you are someone who's always cold and you're contracted like this, or someone who's constantly doing a repetitive motion, then those muscles are staying contracted constantly, or a majority of the time, and that's what the muscle believes its natural state is. Now, if you ignore the spasms and you'll start having constant pain, intermittent pain first, and then constant pain. Then the body will eventually start to weaken the muscle. It will stop sending as much nourishment and oxygen to it because it's trying to weaken it to protect it. So bodybuilders who try, who are building muscle. If one side of the body is building or one muscle in that group is not growing, but the others are, I would bet that there's an active trigger point there, some kind of an injury that's preventing it. So then once the body starves it enough, the other trigger points in surrounding muscle fibers, and in some muscles there are more than one trigger point, so they will become active. Then if enough activity happens, then the muscles will start to atrophy. They'll actually shrink. They will lock up on you. That's when you get frozen shoulders, your back locks up, your knee won't bend. When you stand up, you can't straighten out because everything's so stiff. So those are some signs. That is the language of pain. That is your body communicating to you, and these are the different stages. So if you're in one of these stages, you need to ask yourself, do I want to progress to the next one, or do I want to do something about it now? So then that brings, I had a client who asked me, he's like, why does it have to be a trigger point session? Why can't just a regular massage fix the problem? And the reason is that there are certain techniques in Swedish massage that can alleviate the trigger point, but the therapist has to know where those trigger points are. You can't always just find them by feeling, especially if they're in the earlier stages, like you're just getting spasms, but you're not getting, or it's just heat, but it's not a lot of tension. And sometimes the fibers can be just contracted around the nerve, and the rest of the muscle feels okay if it's early enough in the process. So you have to know where those trigger points are. And then there's actual techniques. Just kneading the muscle will not work out a trigger point. Tapping depotement will not work out a trigger point. It has to be a stripping action. And there's several techniques that we learned that we use in trigger point therapy that are most effective for relieving the stress off the nerve. So one other thing to remember, when you go in for a trigger point therapy session, it is therapeutic. And because we are working close to nerve endings, it's going to be more sensitive than just a regular Swedish massage. But the effects should be immediate if it's trigger point related. If your discomfort is caused by trigger points, you're going to feel better immediately. Now, some clients do feel sore the next day if we aren't communicating effectively. If you're not telling me it's too much, pressure is very important in trigger point therapy. Just full force, bear down, you can't hurt me kind of mentality is not what you want when you go in for a trigger point therapy session. Me personally, when I do deep tissue, I always incorporate a trigger point. I always check for the trigger points. And if I find an active trigger point, I'll shift into and alleviate that trigger point, and then I'll go back to what most consider a deep tissue massage. Okay? Just full force pressure on a trigger point will make you very sore the next day. So we use the pain category. So between 1 and, you want to categorize your discomfort between 1 and 10 during your session. 10 is unbearable, 1 is no pain. You want to be between 5 and 6, and for some people up to a 7. But it should not go above that because again, it will make you very sore, or it could actually make the contraction worse. So it has to be enough pressure that the muscle responds and releases. And sometimes, and I know some of you, because I've personally done this before I learned all this, I would just go full force on it because they want full pressure, you can't hurt me kind of mentality. So I just gave it all. And what would happen is the muscle would just contract more, and it's me fighting against a solid brick. So that's not what you want. And personally, for me, for deep tissue, that's not what I do anymore. My goal during a session is to get the muscle to relax and release its contraction. And even with a deep tissue massage, and even with a Swedish massage, that'll take longer, but that's still my goal, for you to have relief. Anyway, back to trigger point therapy. So, why also does it have to be a trigger point therapy session? Because you do have to communicate. Then the other thing is that when I was talking about Dr. Perry and the pain protocols, every person's body has mapped its pain pattern. If So for some people, if they get a frozen shoulder or they have pain in their arm, it will set off a pain. It will set off a trigger point in their calf, or it'll set off a trigger point in their knee, or that affects the knee and in their quads. So Dr. Perry developed these pain protocol, these trigger point protocols where, let's say you have neck pain. She developed a system so that we could work all the trigger points that would cause pain in that neck area. But then some of us are so special that we've created our own pattern. And so if you have pain in your neck area, sometimes it may be caused by the low back. I've seen that a lot. So, and the body is interconnected. Everything affects everything else. So your body will compensate for its pain and its misalignment or its contractions in its own way. And that's why it needs to be trigger point therapy. The more experience someone has, the more they can feel and see your body's responses to the touch. And that's more important in a trigger point session than, let's say in a Swedish massage. So I hope this has helped with any questions you may have about pain and how a massage can help with that. Again, my name is Belinda, and I am I'm at Plaza Salons in Clear Lake, and you can reach me at 832-784-2593. I also work out of Excellent Salon in Baytown, and you can just go to excellencesalon.com. I believe that's the website, and you can book online, or you can just call them directly, and I don't remember the number. If you want to schedule an appointment, feel free to contact me if you have any questions. Remember, we don't have to live with pain, and sometimes just pushing through the pain isn't the wisest choice either. I hope you have a wonderful day. Bye-bye.